Hello and welcome once again to our online fertility awareness program, You and Your Fertility. We are on the fertility diet edition, and in this particular series we are talking about foods and how they can help improve fertility, looking at the various fertility challenges that are available or that occur with people, and how certain foods can help in the management of those conditions. This is episode 5. So for the past 5 weeks, we've been talking about various conditions and foods. In the first week, we talked about foods generally and how they impact on fertility, when on the fertility journey, what to focus on eating and what to avoid. That's what we had on episode 1. In the second episode, we talked about foods that actually improve the gametes, sperm quality, eggs quality. Foods that can improve these was what we talked about on the second day, or in the second episode. Episode 3, we looked at foods that generally improve hormonal balance. Okay, foods that improve hormonal balance in general. And then in the 4th episode, we looked at specific hormones and the foods that can actually help in improving their levels in the body or their management. That is what we have done so far. So this is episode 5, and we have another very interesting, very exciting topic to treat with you today. Don't go anywhere. Welcome back. So what is our topic for today? Today we are looking at the Pcos diet. The Pcos diet. What are the foods that we are supposed to eat and avoid if you are dealing with Polycystic Ovarian Syndrome? And we're going to be looking at it from various aspects. The first thing I want to talk about is Pcos itself. What is Pcos? Pcos, like the name sounds, Pcos is Polycystic Ovarian Syndrome, and it happens mostly in women. Statistics have it that 1 in 10 women suffer from Polycystic Ovarian Syndrome, and about 12% of all fertility cases is as a result of Polycystic Ovarian Syndrome. As the name implies, it is a syndrome, meaning it has an array of symptoms that seem to be unrelated, but are all emanating from an underlying factor. The underlying factor in the case of Pcos is hormonal derangement. How does Pcos happen? Pcos is as a result of increased amount of androgens found in women. We must have mentioned somewhere among our series that all women have a little bit of male hormones and all men have a little bit of female hormones. So in the case of Polycystic Ovarian Syndrome, the women tend to have a little more of the male hormones, which we term as androgens. So there is a higher level of androgens found in these women, and this is what disrupts their entire hormonal balance, causing the hormonal derangement we talked about. And this then brings a variety of seemingly unrelated symptoms present in the people that have this condition. So typically in Pcos, because of the increased level of androgens, there is an automatic reduction in the ovulation hormones, causing a reduction in the frequency of ovulation. So you have follicles maturing, and because of the androgens, they are somewhat trapped in the ovaries. They are not released as in the process of ovulation found in people without Pcos. And so this trapping of the follicles makes the ovary have this cystic appearance. So it looks like there are small cysts all around both ovaries, because the follicles mature, but they are unable to rupture as in the process of ovulation. As a result, there is reduction in the pattern of ovulation. So you see symptoms like people not menstruating monthly because they are not ovulating monthly. Sometimes they menstruate and have anovulatory cycles. In addition, we have some other symptoms like acne. You have a lot of pimples, so acne around the face and chest in some cases. Some people even develop male pattern hair distribution, so you have some facial hairs, hairs on the chest, hairs on the stomach region. These are the kind of symptoms you see. You see menstrual disorders, scanty menses, excessively heavy menses. You know, in some cases it just fluctuates like that. Then there is obesity, which is usually truncal. So you have a lot of midsection fat in some of the people that have this condition. This obesity can be attributed to the insulin insensitivity that is present in people with Pcos. So their cells are not responding to insulin's function, and the body is not able to utilize glucose, causing these people to have a high-level storage of glucose, which eventually turns into fat and just stores usually in their midsection, giving them that fat midsection appearance. You might see that they might not have so much fat all around their bodies, but in the midsection there's a lot of fat, so stomach fat, you know, basically. These are the kind of symptoms you find with people that have Pcos. So now we understand Pcos, what it is and how it happens, and we have a wide range of treatments for Pcos. But today we want to focus on foods. What foods can help in the management of polycystic ovarian syndrome? The foods are not the cure, as it were. We have to understand that polycystic ovarian syndrome has no cure. The foods are not necessarily the treatment, but it will help enhance the result of whatever treatment the person is undergoing, depending on the range of symptoms the person is having. Underline that not everybody with Pcos have the same symptoms. That is why it is a syndrome. There are a variety of symptoms that can be present, including infertility, and people just have different types of symptoms. Some people are actually very slim, but they have the polycystic appearance of the ovaries, male pattern distribution of hair, and infertility. Some people have menstrual irregularities and infertility. Some people have male pattern distribution of hair and some obesity without infertility. You know, not everybody with Pcos will pick up infertility as a symptom, but unfortunately some people pick up infertility. So we want to focus on that fertility aspect, people who deal with infertility as part of polycystic ovarian syndrome. What foods can help them in their management? Don't go anywhere. The reason we are interested in food when it comes to Pcos is that statistics have shown that dietary modulation actually helps in improved outcome, especially with respect to fertility for those who are managing Pcos. There is increased pregnancy rate, reduced rate of miscarriages, regularization of the menstrual cycle, reduction in the obesity, and general improvement in fertility health. It is also important to note that this androgen fluctuation and hormonal imbalances also affect endometrial lining, which can cause implantation problems, you see, further exacerbating the infertility that might be experienced by the person. So with everything we have said, we want to state that the Pcos diet will have two main descriptions. The Pcos diet should resemble the Mediterranean diet. The Pcos diet also should have a semblance to the diabetic diet. So not that the person is diabetic, but because they are suffering from insulin insensitivity, their meal should be tailored towards someone who has who has diabetes outrightly. And in addition to that, they should also focus on the Mediterranean diet. So one will go deeply into these actual foods now. First on our list are the legumes, particularly beans and lentils. Beans and lentils will help to reduce the glycemic index in the person. You know, we have already said that these people have insulin insensitivity. So it reduces the glycemic index. Glycemic index is the level of glucose present in a meal, thereby requiring more insulin to digest it. So it will improve insulin sensitivity and also reduces glycemic index, making it easier to process digest and utilize in the body. So beans and lentils are foods that people who are dealing with PCOS should really focus on. The second on the list is lean meat. By lean meat, we mean meat that has very little fat on it. So we are focusing on chicken breast. You know, this chest part of chicken doesn't have a lot of fat as against chicken thighs. So you want to run away from your drumsticks and focus more on chicken breast. Then if you are looking at red meat, you are looking at the pure muscle, the one that is commonly called aquara in our local dialect. So you are looking for pure muscle. You are not dealing with the fatty parts of the red meat. Third on our list, we want to look at vegetables, and I was talking about the Mediterranean diet. So you want to look at your different colors of vegetables, your leafy greens, the broccoli, your bell peppers, the different colors, red, yellow, green, your peas, your cauliflower, lettuces, cabbage, all those vegetables, eggplants. The more colorful, remember what we said, the more colorful your plate is, the better you are doing for your fertility health. And particularly with those dealing with PCOS, you want to invest a lot in your vegetables. Another class of food is the whole grains. We cannot stop talking about whole grains when we are talking about fertility health, right? Whole grains like your oats, corn, your brown rice, millet, quinoa. These also, though they are carbohydrates, they have a low glycemic index as well. So you don't invest so much insulin trying to digest them because they have a lot of fiber, they have low glycemic index and are able to be processed faster by the body. Then we want to look at our fruits. Of course, we cannot overemphasize the importance of fruits, but specifically we are looking at your berries, your citrus fruits, your pears, then apples. These are very, very good for people dealing with PCOS. They have a high level of vitamin C, very rich in antioxidants, and also help reduce inflammation. These properties are very useful in managing the effects of the polycystic ovarian syndrome on the body and particularly on the reproductive system. Finally, we want to look at olive oil. If you can replace your vegetable oil completely with olive oil, it will be doing the system a whole lot of good. Why? Because olive oil is an antioxidant on its own. It has very high anti-inflammatory properties and generally helps with the Pcos syndrome and symptoms in the person. So all these I have mentioned, what is a typical meal plan like? In the morning, you can have oats, sprinkle some chia seeds on it, add your milk, and you're good for the day. For your lunch, you could have brown rice and vegetable sauce. You know, you have your tomatoes and your bell peppers, and then maybe some broccoli or cabbage, all of them salted, and then you use it to eat rice, your brown rice, and then with lean meat, of course, and maybe with a squeeze of some of your citrus fruits. That is perfect for your lunch. For your supper or your dinner, you might want to have a serving of maybe oat swallow. You know, there's oat swallow now, and with vegetable soup. So things like that, you just want to keep exploring with these varieties. If you are somebody who enjoys snacking, you are not left out. You can do a handful of your chia seeds mixed with your pumpkin seeds, add some honey on it, put some toasted nuts and toasted oats, and you are good to go. You can take your yogurt, of course, unsweetened yogurt, sprinkle some chia seeds on it, or sprinkle grounded flax seed on it, and you are also good to go. Stock up on your fruits, your berries. Those are very good snacks for you on the management of PCOS. If you like biscuits, look for your whole grain crackers. Whole grain crackers are healthy, and because of the whole grain attributes of it, it will not add a lot of carbohydrates to the system. So that is something you can also snack on with your juice or plain yogurt drinks, and you have all the snacks that you want. We've talked about what to eat. What are the things that you should avoid? Avoid processed foods. Avoid refined carbohydrates. Avoid trans fats. Avoid caffeine. Avoid sugary drinks. Avoid them like they are plagues. because these foods worsen, they exacerbate the symptoms of polycystic ovarian syndrome. They worsen the menstrual irregularity, they worsen the obesity, because these foods I have mentioned have very high glycemic index or indices, makes it very difficult for insulin to break them down, worsens the insulin insensitivity already present because of the syndrome. Avoid alcohol, avoid high mercury fish, so like your swordfish, those very deep king mackerel, deep sea fishes, because of the high level of mercury they contain. You also want to avoid them. Avoid salt, guys, avoid a lot of sodium, and you find that in a lot of processed snacks and processed foods in general. Avoid baked foods, all our pastries and all of that. Of course, we have already said everything made with flour should be avoided as much as possible. So that is that for the foods. What are the other life hacks that you can apply to help in the management of polycystic ovarian syndrome? Stay with us. Some of the other things that you can do apart from the foods we have mentioned to eat and the ones to avoid are the following things. One, when you're eating, eat as slowly as possible. This helps you to feel full faster, so you find out that you eat less food. Okay, also you can apply eating smaller quantities of food even more times than the usual 3 times a day. So you pick the right foods, you eat small quantities and spread it over time. It reduces the quantity you eat at a time and helps in the expenditure of the food absorbed, and then reduces the amount stored that will convert into fat. Second hack, you want to stay hydrated. Drink lots and lots and lots of water. We cannot overemphasize that. Have a meal plan. Plan that today I will eat this in the morning, this in the afternoon, this in the night. Prepare towards it, work towards achieving that, so that you don't fall into the situation of, oh, I'm hungry, and you just eat anything that you see. So having a meal plan helps you to stay focused on what you are supposed to eat and help you avoid what you are supposed to avoid. Get enough sleep. Sleep up to 7 to 8 hours if it is possible. If you cannot make it up to 7 hours, at least manage to get up to 6 hours of sleep every night. It will help in the regularization of the Pcos symptoms. Avoid stressful situations. We've already said that stress is a lot of things. Sleep is one of them. But as much as you can, avoid exertion, avoid emotional trauma of any kind, avoid stress. Exercise. Yes, exercise is another thing that is very good for those with Pcos. For exercise, you might not necessarily register in a gym and start having regular workout sessions in a gym. No, you can find something that works well with your routine, and then you just stick to it, be regular with it, and you can be getting enough exercise just by doing that. It could be walking in the mornings or walking back from work, things like that. Whatever you can do consistently, stick to that and you'll be getting enough exercise. Finally, take supplements. There are certain supplements that actually really help with Pcos. Supplements like your spirulina is very effective and very good for those dealing with polycystic ovarian syndrome. You also want to stock up on your omega-3 fatty acids. That supplement also very good, also very helpful. Vitamin D is another very important supplement when managing polycystic ovarian syndrome. Look also for supplements that have inositol. Inositol is another one you want to look out for. Very helpful in managing Pcos. So this is where we'll be stopping for today. Thank you for staying with us. We hope you have learned something. We want you to know that implementation is key. It is one thing to learn, it is another thing to implement. Do your best to put these things into practice. Work with your healthcare provider and you'll find out that very soon your system will start having that improvement and you're on your way to achieving pregnancy. Thank you once again for staying with us. If this is your first time viewing any of our videos from Love Foundation, please hit that subscribe button now, like our posts, follow us on our social media handles, Instagram at love_foundation, YouTube at love_foundation, Facebook at Love Foundation. Just look for Love Foundation on these media handles and follow us. Remember, learn to teach others. Until we come your way again next week with another interesting fertility diet episode dealing with another type of fertility challenge. Stay blessed.